Greetings. My name is Dr. Vincent Roddy, and I'm an emergency physician here in Miami, Florida. I wanted to ask the President a few questions before the final debate, while also giving voters additional information to consider before they head to the polls. As an emergency physician, not only am I concerned about the continued toll the COVID-19 pandemic is causing on the health of our nation, but also about the negative mental health consequences of fighting what at times seems to be a never-ending pandemic. I say never-ending because critics have stated your administration never took the threat of the virus seriously, and unfortunately the nation is on month 7 while infections continue to rise around the country. Contrast that to other countries who mandated masks and instituted widespread testing. Our performance as a nation is lagging far behind. Mr. President, COVID fatigue is a real thing. Doctors and medical staff are tired of doing the work and not feeling supported on the federal level. It is upsetting to physicians and healthcare professionals around the country to see you not wear masks and to continue to hold public events where social distancing guidelines are not being followed. When those persons become predictably sick, they not only put themselves at risk, but they put the health of the healthcare providers as well as their families at risk too. We're happy to help sick people. We will never complain about that. However, we should not be seeing the federal government encourage behaviors that lead to more illness, death, and the possible overloading of our nation's health infrastructure. Mr. President, we know that masks work, yet you still do not always use them. Your event in the Rose Garden, where high-ranking government officials attended, many of whom did not wear masks or social distance, was subsequently labeled as a super spreader event where you and many others later tested positive for COVID-19. Former New Jersey Governor Chris Christie tested positive for COVID-19 after attending that event and was later admitted to the ICU for 7 days. He, like you, received experimental drugs and round-the-clock medical care. Fortunately, he recovered. What is not so fortunate is that over 200,000 Americans were not afforded the care and considerations you, Mr. President, and the former governor received. Question: is the federal government willing to subsidize expensive, cutting-edge medical care for all Americans infected with COVID-19? Does the average American not deserve the same level of care when sick than you received, Mr. President? Also, is the federal government finally going to send Americans needed personal protective equipment like N95 masks paid for by our tax dollars so that we can have all that we need to stop the spread of COVID? If the answers are yes, then great. Mr. President, are those details in your Obamacare replacement plan that you've talked about since before the election in 2016? Can you please share the details of your plan? I agree with you, Mr. President. We do need healthcare reform in this country. However, smart, pragmatic reforms that support health workers while also supporting patients, building on the foundation laid by Obamacare, would be best in my opinion. Lastly, Mr. President, I would be remiss not to mention this. At current, the 2021 Medicare physician fee schedule is set to cut physician reimbursement to all doctors by up to 8% starting next year. This is totally unacceptable. The federal government must support its health workers and not institute pay cuts after we have been risking our lives on the front lines doing the very work that only few are truly qualified to do. Mr. President, I'm actually a physician and a medical scientist. I'm not just playing one on TV. My question to you: if reelected, will your administration, through legislation or executive action, cease these pay decreases and support healthcare workers as you should? In conclusion, Mr. President, many of my former colleagues, physicians in Fort Lauderdale, supported you in the 2016 election. I would like to ask you, as well as them, this final question. Is this what Make America Great Again looks like? Ignoring health experts, not following proper safety protocols during a pandemic, not sending all Americans personal protective health equipment like masks and other pieces of equipment paid for by our tax dollars, and in the end, mandating pay cuts for medical workers as we fight an ongoing pandemic? I personally do not think so, but if you have answers to my questions, Mr. President, we would love to hear them. Respectfully, Dr. Vincent Roddy, Miami, Florida.